development of the July 22nd revolution, the Gambia's healthcare delivery system has been significantly transformed from a basic service provider to a more comprehensive and well-structured scheme. Mindful of the fact that there could be no meaningful development without a healthy population, the provision of accessible and affordable quality healthcare services has been the hallmark of the APRC government for the past 20 years. This is evident by massive investments government continues to make in the health sector, particularly in the areas of infrastructure and human resource development, as well as the procurement of state-of-the-art medical equipment.
We have placed huge emphasis on the scaling up of basic and comprehensive curative and preventive healthcare services by reaching out to communities around the country, especially hard-to-reach areas. It is gratifying to know that all communities in the Gambia are now reaching reasonable reach of a health facility. The July 22nd revolution resulted in the establishment of many health facilities at all levels, from primary to tertiary. Prior to 1994, there were a total of 28 health facilities throughout the country, with only 2 being major referral hospitals, that is Bansang and Banjul. At the moment, again, thanks to the revolution, there are 91 health facilities, out of which are six are major referral hospitals, strategically located around the country to ensure universal coverage. Currently, projects are well on the way to construct 4 more new health facilities to be completed by the end of this year. The Minister of Health will ensure continuous improvement of services and facilities at all levels of the public health system and at affordable costs. The doctor-to-patient ratio is being improved, especially with the training of homegrown doctors at the University of the Gambia.
In addition to these 3 modern referral hospitals, government went further to upgrade all regional healthcare centers in rural Gambia to major health facilities, all geared towards bringing healthcare services to the doorstep of all Gambians.
You will recall that in the colonial era there were only 8 health facilities countrywide. Only 8 health facilities, and 2 were hospitals, one in Bansang, one in Royal Victoria Teaching Hospital, now Edward Francis Small Teaching Hospital. The Second Republic came, and then that increased to 28 health facilities, still with the 2 hospitals available, and some minor and major health facilities. But the July 22nd revolution witnessed the availability of 91 health facilities, out of which 6 hospitals, major hospitals, tertiary hospitals, and they are all strategically located. The overall aim of the National Health Policy is universal health coverage. We want to ensure, and inshallah will ensure, that there is adequate coverage. We bring the health services to the doorsteps of the citizenry, 1, and every 5 kilometers of every community, you will have a community health nurse responsible. Every 10 to 15 kilometers, you will have an ambulance with a community health nurse, or a major or a minor health facility. Right? So in this case, there's nobody would need referral to the next level Go on, try to look for a taxi or a horse cart or a donkey cart. Ambulances will be available, and it is available. It's happening. But what is most important is every 50 kilometers, you have a major health facility with an operational theater, with trained staff, medical doctors. So there's nothing like you have to travel 300 kilometers for the next person to be operated. No. That is history now.
When you take the health sector today, a medical historian will tell you that there are so many changes that have taken place in the health sector. I want to break down the whole health sector into two components. The health sector is composed of two main pillars. You have the preventive part and then the curative part. And seeing the health sector these past 20 years, the Gambia is blessed with one thing. It is able to combine both the two sectors and has moved the two sectors together. That is why we have an excellent health sector in place today in this country. In the preventive part, you have the EPI, which Gambia has a record of one of the best in the sub-region. Almost, we have something like more than 93% immunization.
The concept of a comprehensive healthcare package certainly encompasses both remedial care and other socio-economic determinants of health. It was against this backdrop that President Jammeh introduced Operation Clean the Nation with a view to promoting environmental sanitation and mitigate health risks associated with poor waste and environmental management. This initiative does not only keep communities clean, but also helps significantly in reducing the incidence of malaria in the country.
One of the causes of preventive blindness that they can prevent, which is a global problem, is through just simple face washing, environmental sanitation. Glaucoma, for example, is one of the leading causes of preventable blindness. The more clean the environment is, the less you have a disease. Okay? That is not a political thing. And it is a WHO strategy. WHO is 4 strategies to eliminate glaucoma. The Gambia is going that way thanks to Operation Clean the Nation. It's having an impact. It's contributing factor. Those who have the lead defects with this surgery, those who have antibiotics, we need to give antibiotics, and in the Gambia we're giving it free. Face washing and environmental sanitation. And this is not Gambia government saying it, it's WHO saying it. Come to tuberculosis, environment sanitation. Okay? Come to malaria. Buildings for malaria. What is the politics in that? These are basic common sense. It's only that government is even helping us because you see, we should argue that prevention is cheaper than cure. Not even better, but cheaper than cure. But how will you feel like cleaning the environment? There's no flies to cause diarrhea. There are no mosquitoes to cause malaria. There is no flies again to cause glaucoma. You live a healthy life, you get up, go to work and come. Okay, you keep a dirty environment. Malaria is there, glaucoma is there, diarrhea is there, TB is there. Okay? Okay? Then that day you don't go to work, you have a family to feed. Okay? You become very unproductive. You cannot go to school. Is that what we want for this country? Now let people start thinking. Let's leave the politics and think logically. Operation Clean the Nation. I wish that environmental components referred to the Ministry of Health. Then we will still work harder, but there's more lot to be done. And it's not the government to come in and say this is what we should do. This is just common sense that people should understand. These are things.
You go to the Sensible program. The Sensible program is such a program is a program which has helped tremendously in the health sector in one way or the other.
In its drive to achieve universal access to quality healthcare delivery, Government of the Gambia, through a judicious national health policy, initiated several health projects and made numerous interventions which have helped to reduce infant mortality, improve maternal health, and combat HIV/AIDS, malaria, and other diseases. These initiatives made the Gambia one of the few sub-Saharan countries that has registered substantial progress in healthcare delivery. One particular project that has recorded a resounding success in these areas is Operation Save a Baby, under the stewardship of the Gambia's First Lady, Madam Yaya Jammeh. Given the daunting nature of quality healthcare delivery, the government of the Gambia soon realized the need to diversify the country's healthcare services through the promotion of public-private partnership in the health sector. Also, by virtue of his generosity and wisdom in herbal medicine, the Gambian leader initiated what is widely known as the President's Alternative Treatment Program. Since the inception of the program, President Jammeh personally cured thousands of people of some of the most intractable ailments such as HIV/AIDS, diabetes, asthma, and infertility, which were until now declared incurable. Dr. Tamsin Bow is the director of the President's Alternative Treatment Program.
One very interesting thing, when you talk of medicine itself originated from traditional. The conventional medicine that we are practicing today, it originated from traditional medicine. And when you are able to blend the two together, the conventional part and the traditional part, you're creating more good than harm. So you'll see that there are so many medications present within the system that are basically from the traditional part of medicine. And when you check this country, we are blessed with one thing, having not only a leader, but a knowledgeable leader who is also a seasoned medical practitioner. What I mean by being a seasoned medical practitioner does not mean that being called a doctor or just knowing medicine. For you to practice medicine, or for you to be a seasonal medical practitioner here, you have to have the love, the knowledge, the charisma, and the ethics of medicine, of the field. That helps the individual medical practitioner to really perform the real duties of a medical practitioner. And those are the characters that His Excellency is having. He was able to declare to the whole world back in 2007, 17 January, that there was a solution to the HIV/AIDS program. To me, whenever I think of the program, it reminds me of one thing. I think there was a real misconception and misunderstanding. What basically he was trying to tell the world was that, look, by using traditional medical herbs, we will be able to eliminate the virus from the human system. So it was interpreted in a completely different way. People thought, well, this is incurable, and something incurable cannot be cured. And look today, His Excellency was able to use the scientific part of medicine, the latest scientific part, that's the laboratory test to show the viral load of an individual patient before and then after the treatment, thereby proving himself. I don't know whether you understand. I understand. Combination of modern science with the traditional medicine, he was able to achieve what he has achieved today in medicine.
As part of efforts to further consolidate the gains made in the health sector and enhance quality healthcare delivery, the APRC government further formulated the 2012 to 2020 National Health Policy for the acceleration of quality health service and universal coverage in the country.
Since 1994, one of the recent achievements include the posting of our own homegrown Gambian doctors. These doctors are posted in the major health centers and hospitals across the country. This is geared towards bringing quality health service to the doorstep of all Gambians. And in fact, this has tremendously reduced the number of referrals to our main referral hospital, Edward Francis Small Teaching Hospital, and has also significantly reduced the number of preventable mortalities and also worries that usually our rural Gambians do have when they are referred to Banjul, and has really cut down the number of unnecessary referrals to our main referral hospital. And in this way, we are also able to bring emergency essential surgical interventions to the doorstep of all Gambians in this country. In addition, the Ministry of Health is also embarking on the revitalization of PHC primary health care services. We are trying to expand and strengthen PHC in bid to bring access to essential services to the doorstep of every Gambian in this country or non-Gambian in this country. So in this way, we'll be able to take care of most of the problems that our rural population suffer from.
However, these investments will leave much to be desired in the absence of the required pool of highly qualified medical doctors. In view of this, government of the Gambia, under the wise leadership of President Jammeh, transformed the then RVH into a teaching hospital and offers scholarships to scores of Gambians to study medicine at the University of the Gambia and in all the universities abroad, and a good number of Gambian doctors trained by the Jammeh administration are now currently serving across the country.
Gambian doctors serving Gambians and non-Gambians alike in the Gambia. This is just brilliant. This is just superb. And the advantage it has reduced our number of dependency on foreign doctors, medical officers in general, coming into the Gambia. And that's a savings for the Gambia. For example, in Cuba, we used to ask for like over 100 medical officers. But now we have reduced it by 50%. Yeah, where we have our own. And gradually, we're going to win out.
We will have a graduated student in the Gambia. We went 5 years through the medical school. We teach them there, we train them at the university, at the hospital, and we are very proud, all lecturers are very proud, to give Gambia another 35 young Gambian doctors. So obviously when you have got the manpower improves, and these young people, we tell them from the beginning, we said, don't think that when you finish, you'll be the only working in Banjul. It's not the case. We have set a plan for the student therefore now becoming young doctors. They also go and serve in the country, in the health centers, because those health centers need now more doctors.
Among the success stories of the Gambia's health sector is the recent brain surgery conducted at the Edward Francis Small Teaching Hospital in Banjul, the first ever in the country, and within the team of surgeons, a Gambian doctor. This important milestone in the country's medical history, alongside several other health projects, including the country's state of preparedness in the wake of the recent Ebola outbreak in neighboring countries, are glaring facts that the huge investments made in the health sector are indeed paying dividend.